Joining us first is Dr. Ameer Kabour, a cardiologist and Senior Medical Director of ThedaCare Cardiovascular Care. Dr. Kabour, thanks for being with us.
Thank you very much for the invitation.
So we're going to play a little game today to kind of get us into heart health in our conversations. This is myth versus fact. So I'm going to ask you a series of statements and mention those, and then you're going to tell us if they are myth or a fact.
Sure, absolutely.
All right, the very first one here. Heart disease is more of a concern for men than women. Is that myth or fact?
It's a myth, and there is a reason for that. It used to be in the past, when we didn't have that much of knowledge about women heart disease, that men are more commonly coming to the visits and heart attack and all of that stuff. So we made that statement. But currently, really, there is no difference. Both could have heart problems, similar in every fashion and statement. Actually, it's more difficult to deal with the woman's heart disease because their symptoms is very atypical. One time I had a patient who had a heart attack and she was having some dental ache, and that's it. And then we figured out too late that she had a heart attack. If you have a very unusual symptoms, some kind of problem, please go to the hospital, go to the emergency room, go to your doctor, talk to them, and get the right diagnosis before it's too late.
Good to know. All right, our next one here. If heart disease runs in your family, you can still take steps to reduce your risk.
Absolutely, it's a fact. And the reason for that, every one of us has to be intelligent. I call it to be smart regarding taking care of yourself. If you have a family history, it's a strong risk factors for having blockages in the arteries, having a high blood pressure, having a high cholesterol. Go to your doctor on a regular basis and let your family doctor assess you and evaluate you and treat you. At the same time, lose weight. Take care of your cholesterol. It's very important to have it checked on a regular basis, at least annually. You cannot change your gene. That's what you need to remember. So for that reason, taking care of these steps and modify your lifestyle to improve your quality of life, that's very important.
Okay. Our next one. It's mainly older people who should be concerned about their heart health.
That's a myth. And the reason for that, it's younger and older. Actually, these days, we see the younger people having more heart problem because we are more aggressive in diagnosing their heart problem. The youngest heart attack patient I had, 29 years old. So that's a reminder for everyone.
Wow. Okay, good for us to remember that. All right, if you have heart disease, you should avoid exercise.
Oh, that's a myth. I mean, you absolutely not. Actually, we encourage exercise. We want the people to exercise when they have a heart problem because that's a way to improve their quality of life and get their heart back to normal.
Okay. Even if you eat well and you're fit, you should remain vigilant about your heart health.
Absolutely. It's a fact. No matter what you do, you should pay attention to your heart and be vigilant, and you have to take care of yourself no matter how good you are.
That's, again, really important things for us to keep in mind.
Absolutely.
Okay, so thanks for talking us through all of that. Later in the program, we're going to talk more about prevention and steps that you can take. I do want to talk to you about a few other questions that we have when it comes to heart health.
Sure.
Can you just tell us again kind of why routine care is so important when it comes to your heart?
The routine care is going to do some extra diagnostic step to allow the physician to have an idea about the risk of that individual to have a heart problem in the future. So he is the one who ordered blood tests for the patient and come up with the cholesterol and blood sugar and can detect if these patients can get or require treatment, specifically medication, exercise, diet. That by itself will reduce your chance of having heart problem by about 40%. 40%, that's a huge number. The second step, they do some testing, like, for example, an EKG. Don't question why they are doing it, because some of the changes which we see it in the EKG, it could be the early sign for having major heart problem. Believe it or not, most of the heart attack or blockages, we discover it at the first site when we do basically the EKG for those patients.
Oh, that's all good information. We also know that ThedaCare is here when it comes to comprehensive cardio care services. Can you talk about the care options that are offered here?
Oh, absolutely. You know, we offer all of the diagnostic testing possible needed for heart patients. We do every single procedure you can imagine. We do structural heart. I mean, like some of the patients, we don't send them to open heart surgery for valve replacement. We do it percutaneously through the groin. We call it TAVR or mitral clip. We do all of the imaging possible for the patients, from MRI to CT scan to the regular stress test and the simple stuff, which is including the EKG, and see a cardiologist.
Perfect. Dr. Kabour, thanks so much for being with us and explaining all of this.
It's my pleasure. Thank you.